Off-label medicine cocktails, combined with low-dose chemotherapies, have been studied in various cancers. Here, I would like to share a recent study of MEPED in lymphoma. MEPED was developed by the team of Dr. Reutner and Dr. Grube from the University Hospital of Regensburg in Germany. Firstly, I would like to congratulate them on their achievement. MEPED, an abbreviation for metronomic chemotherapy. Everolimus, pioglitazone, etoricoxib, and dexamethasone, is an all-oral treatment cocktail. Here, you will see that therapy with MEPED is highly effective in patients with Hodgkin's disease from the initiation of MEPED therapy. The patient, a 57-year-old man, was diagnosed in 2014 with stage 3 nodular sclerosis Hodgkin's lymphoma with lymphadenopathy and splenic involvement. Therapy was initiated with 5 cycles of chemotherapy using the BEACOPP regimen. In February 2020, the patient presented with left cervical swelling. FDG PET scan revealed lymphadenopathy, and a biopsy of a left cervical lymph node confirmed a relapse of Hodgkin's lymphoma. Subsequently, targeted chemotherapy with brentuximab was administered. However, in October 2020, after 7 cycles of therapy, the patient experienced a second progression. In November 2020, the treatment approach was shifted to immunotherapy with pembrolizumab, leading to partial remission. Despite this, in April 2022, after 24 cycles of immunotherapy, PET scan once again indicated third disease progression. Consequently, the patient was commenced on a cocktail treatment regimen consisting of MEPED. The MEPED therapy regimen is a comprehensive and multifaceted approach for treating Hodgkin lymphoma, combining several drugs with different mechanisms of action to target cancer cells more effectively. Here's an explanation of how each component of the MEPED regimen works and why they are combined. Pioglitazone, primarily used to treat type 2 diabetes, pioglitazone works as a dual peroxisome proliferator activated receptor PPAR alpha and gamma agonist. It exerts its anti-cancer effects by activating PPAR, which are nuclear transcription factors that regulate gene expression, involved in cell proliferation, differentiation, and survival. The activation of PPAR alpha has an anti-inflammatory effect, while the modulation of PPAR gamma can influence tumor growth directly. The efficacy of pioglitazone as an anti-cancer agent is enhanced when used in combination with COX-2 inhibitors, as they increase the accessibility of PPAR ligands, thereby amplifying the drug's anti-tumor activity. Metronomic chemotherapy with treosulfan. Metronomic chemotherapy involves the frequent and regular administration of chemotherapy drugs, at doses lower than the maximum tolerated doses, with minimal or no drug-free breaks. This approach aims to minimize side effects, while targeting the tumor microenvironment, inhibiting angiogenesis, the formation of new blood vessels that supply the tumor with nutrients and oxygen, and stimulating the immune response against cancer cells. Treosulfan is used here as the chemotherapeutic agent, chosen for its effectiveness and manageable side effect profile. Everolimus, an mTOR inhibitor. Everolimus targets mTOR signaling pathway, which is crucial for cell growth, proliferation, and survival. The mTOR pathway is often dysregulated in cancer, leading to excessive cell growth and proliferation. By inhibiting this pathway, everolimus can slow down or stop the growth of cancer cells. Etoricoxib, this is a COX-2 inhibitor, which blocks the cyclooxygenase 2 enzyme. COX-2 plays a role in inflammation, and is often found at elevated levels in various types of cancer, contributing to cancer progression and resistance to therapy. By inhibiting COX-2, etoricoxib can reduce inflammation, and potentially limit tumor growth and spread. Dexamethasone, this is a corticosteroid used for its anti-inflammatory property. In the context of cancer therapy, dexamethasone can help reduce inflammation, manage side effects of chemotherapy, and potentially exert anti-cancer effects through various mechanisms, including apoptosis and ferroptosis of tumor cells. Dexamethasone can promote the excessive accumulation of reactive oxygen species, and weaken antioxidative stress system GPX4. Dexamethasone induces cancer cells apoptosis and ferroptosis. By combining these diverse agents, the MEPED regimen targets the cancer cells and their environment from multiple angles, aiming to overcome resistance mechanisms and improve outcomes for patients with refractory relapsed Hodgkin lymphoma. This approach not only seeks to directly inhibit tumor growth, but also to modulate the tumor microenvironment, enhance the immune response against cancer cells, and reduce inflammation and modulate redox systems. The patient exhibited a dramatic response. Just 3 months after initiating MEPED therapy, complete remission was confirmed through PET imaging. The treatment was well tolerated, with no impact on the patient's daily life, due to the absence of hematologic or other organ toxicities. However, several months later, the patient developed leg edema followed by pneumonitis, leading to the discontinuation of MEPED. Despite this interruption, the patient remained in remission. The case presented here demonstrates that MEPED therapy is a well-tolerated regimen, with a favorable safety profile, making it a suitable treatment modality for achieving sustained remission. However, patients undergoing this therapy should be closely monitored for potential side effects such as weight gain and edema, which may arise from pioglitazone and everolimus-induced pneumonitis. The therapeutic effects of MEPED were observed rapidly and were sustained over an extended period. Nonetheless, larger prospective studies are warranted to validate these findings. Moreover, the potential benefits of MEPED in treating other types of cancer warrant further investigation.